This week's Ask Dr. Durie comes from a patient who is quite concerned, having experienced their first relapse after initial therapy. And the specific question is about the use of carfilzomib, commercial name Kyprolis. And the question is a Kyprolis combination a reasonable option for my first relapse? And the simple answer is yes, indeed. Kyprolis is an excellent option. In fact, Kyprolis is FDA approved as a choice in this first relapse situation. Two very large trials have been conducted to assess the use of Kyprolis as a doublet. So that would be Kyprolis plus dexamethasone, KD, or Kyprolis as a triplet, and this would be KRD. And so if we look at the doublet, obviously this is a simpler regimen, better tolerated than the 3-drug combination, and one which is given at a slightly higher dose. In the Endeavor trial, the Kyprolis was given at a 56 milligram per meter squared dose, so a little bit higher dose, and infused over 30 minutes. But the results of the doublet were very good, with a remission of over 18 months, significantly better than the Velcade Dex comparator in this particular trial. So an excellent option, especially in a little bit older patient, if a triplet is not feasible for some reason. In the triplet combination trial, the Aspire trial, the KRD was compared with RD, and again, the Kyprolis combination was significantly better than the Revlimid and Dex 2-drug combo. The remission was in this case over 2 years with the KRD combination, and the overall survival over 4 years. And so this triplet combination in the first relapse setting is really an unusually good option to be considered, with excellent response rates and obviously excellent remission and overall survival benefit. But like everything, you do need to be cautious of the opposite. Well, what are the side effects or cautions with this type of therapy? And so there are definitely some important Kyprolis related side effects which are a little bit different and need to be considered. The most important ones which are different and could be a problem are those related to heart side effects or lung side effects. There can be an effect to cause irregular heartbeat or even a tendency to heart failure. There also can be an impact with increased overall blood pressure, or blood pressure in the area of the lungs may be increased. The patient may experience shortness of breath. And those are important side effects that can occur in a small percentage of patients. And this is really important to be as a basis for monitoring and follow-up, because the other aspect of Kyprolis is that it needs to be given with a little bit extra fluids. And so those fluids are given over approximately 30 minutes, especially with the first dose. And so if you're giving extra fluids, this could accentuate heart or lung side effects. And so the main caution about the administration of Kyprolis is that the doctor needs to be very alert, especially with the first few doses of the therapy, to make sure that there are no heart or lung complications which are emerging. But the bottom line for this particular patient is that Kyprolis as a doublet or as a triplet is an excellent option. The doctor needs to watch closely with careful monitoring, and the patient also needs to be aware of these possible side effects. But there is every chance that an excellent response can be achieved, and that this can produce a long and good remission with improved survival.